this study has highlighted that we need to broaden our response to gender inequality in the region. I think there's a big unfinished agenda in terms of things like son preference, child marriage, violence against girls, but we also need to look at some of the broader impacts on adolescent girls in particular. So things like employment and economic participation and emerging health risks. I think it's also brought a focus to the need to better reach boys with gender programming. Gender inequality, rigid gender norms are also harming boys in the region. They have higher mortality compared to girls, particularly due to injuries, violence and suicide, and higher rates of risky behaviours such as alcohol use and tobacco smoking. There's a real need to make sure we are also reaching adolescent boys. But I think really the key thing that this study has done has shone a spotlight on early adolescence as a critical time to address gender inequality. It's where gender inequalities become more prominent, but it's also where gender socialisation intensifies, where young people are consolidating norms and roles with profound impacts for their health and well-being. And these outcomes aren't inevitable. Early adolescence is a really important window of opportunity to intervene, to address inequalities, to transform gender norms before they become entrenched, and therefore enable young people, girls and boys, to realise a more equal future.